Welcome back to my YouTube channel, and the topic of discussion for today is the resto materials, and we will be discussing different types of the restorative materials that we use in the dental clinic and their properties as well. So the first slide that we're going to talk about is the optical properties. And the first thing we're going to talk about is the three important properties that are important during the stage selection. So the number one is the chroma, the second is the value, and the hue. Out of these three, the most important one is the value. So value is basically how much bright or dark the color is. And chroma is basically the saturation or the strength of a color, means degree of the saturation. Like if it is a yellow color, how much yellow that color is. If it is blue, how much blue that color is. And hue is actually it simply means the color, like red, green, yellow, blue. So it is basically synonymous with the term color. So value is the most important color characteristic in shade matching, so it is very important. The higher the value means the more brighter the color is, more lighter the color is, and lower the value means the darker the color is. So going ahead, too high a chroma is impossible to decrease in hue or increase in value. Means if the chroma is high, means the saturation of a color is, if it is too high, you cannot decrease that color, right? Because it is already at a saturation. Or even you cannot increase in value. Increase in value means like it is brighter, you cannot make it lighter in color, right? It is already dark. So staining a porcelain restoration will reduce the value, obviously, because if something is already white and you go and stain that something, you are reducing the value, means you are reducing the brightness. Adding a complementary color can also reduce value. It is almost impossible to increase the value. Now, what does this point mean? Like, if something is already white enough, you cannot just make it more white, right? So it is already bright enough, and so you cannot keep on increasing a white color. So moving ahead, we will be talking about amalgam. Now we know that amalgam is an important filling material or restorative material. Amalgam is an alloy of mercury and one or more other metals. Now, how is amalgam produced? We actually mix the liquid mercury with solid particles of an alloy containing predominantly silver, tin, and copper, and a little amount of zinc and palladium are also present. And every component has its um, own benefits. So silver is Ag is silver, Sn is tin, Hg is mercury. I'm sure you guys already know all this, but just a simple point. So what does silver does in amalgam? It increases the strength, expansion, and it decreases the setting time. And tin on the other hand will decrease the strength. It is basically opposite of what silver does. Decrease the strength, expansion, and increase the setting time. And what is the function of the mercury? It initiates the reaction with the alloy. So tin aids in amalgamation process because it has greater affinity to mercury. So that's why tin is very important in amalgam, because it is basically the one that will go and bind to the mercury, and the process of mixing will start. Moving ahead, so this is basically the simple silver. So it is the simple formula that we use in the amalgam, and in this AgSn, which is silver tin, is the gamma phase. So some of it is being made again when they react, which is gamma 30%. Silver and mercury is gamma 1, which is 60%, and tin and mercury is the gamma 2, which is only 10%. So gamma 2 is the weakest and the softest phase. It is actually not a very good phase that we want in the amalgam. So it is most susceptible to corrosion. The volume of gamma 2 phase decreases with time due to corrosion. So we try to, so this is basically present in low copper amalgams. In high copper amalgams, obviously the gamma 2 phase is eliminated. So if anybody asks you in the questions like what is gamma 2 phase, it is basically tin and mercury. Now moving ahead, let's talk a little bit about high copper amalgam. Again, This is just a formula, so it is again silver and tin plus copper plus mercury will form silver and tin plus silver and mercury plus tin and copper. If you see here, there is no gamma 2 phase. So high copper alloys, they are corrosive resistant, so the corrosion doesn't happen in them. Um, it has increased strength and decreases the tarnish and the corrosion and creep. So basically all the good qualities high copper amalgam process has it. So low copper alloys are not used anymore, and specifically why? Because of the gamma 2 phase. Now let's talk about a little bit about zinc. So zinc is present in amalgam in like less than 1%, right? It decreases the, and what is the advantage? It decreases the oxidation of the other elements. Basically, it acts as scavengers. Provide better clinical performance because there is less marginal breakdown. Alloys without zinc are more brittle, and their amalgam tend to be less plastic during condensation and carving. It can cause something known as delayed expansion but with only low copper alloys if it is contaminated with moisture during condensation. So it is something the disadvantage of the zinc. So moving ahead, let's talk about the particle size. So the smaller the particle size of the copper in the amalgam, the smaller the surface area per particle. So we know that when the particles are small, it is easier to wet them with the mercury. If it is a bigger particle, means they require more mercury. So smaller the particle, less the mercury will be used, and the better the wetting will be with mercury. So the faster the setting, and they will have great early strength. So that's why we prefer small particles. So smaller particles, so larger surface area per unit volume needs more mercury. So what does this means? Like these 2 points contradict each other. So if I say that if it is a smaller particle, means it will require less mercury. But if this if I've got lots of smaller particles, right, and the large, but it will have a large surface area per unit volume. So to wet this much of smaller particles will require more mercury. And the spherical particles, less surface area per particle, less mercury is needed, 42% faster setting and faster wetting. Late cut particles, are they are bigger in size, so will require more surface area per particle. More mercury is needed, like 40, even more than 50%. So they will have slower wetting and slower setting. So rule of thumb, the faster the amalgam sets, the more likely it will shrink rather than expand. If setting time is increased, it would expand. So before this, they used to think that the faster the amalgam will set, it is going to expand. No. Now they say that the faster the amalgam set, it is more likely that it will shrink rather than expand. Moving ahead to the next slide. Now less free mercury. So if whenever the mercury is less, the setting is going to be faster, which was seen in smaller particles, and there will be decreased setting expansion. Whenever there is increase in the mercury, it will lead to slow setting, and there will be increased setting expansion. Now increased trituration time, when I say increased trituration time, it is more than required. The more the time, it's the normal, more than the normal time required for the trituration. So it will decrease the setting expansion. Increased condensation pressure will decrease the setting expansion. Smaller particle size will also decrease the setting expansion. Moving ahead, let's talk a little bit about bases, liners, and cements. So what is liners? Liners are basically of two types. They are solution or suspension liners. So the solution liners can be varnish, and the suspension liners can be something known as calcium hydroxide. So they are applied in a very small amount, thin layer to seal off the tubules. When I say tubules, means the dentinal tubules, so that there is no sensitivity. Organic solvent bases, water insoluble. Used to line cavity up over cavo surface margins to prevent it. So whenever there is, you are drilling down and you feel that you are closer to the pulp, it is better to place a liner so that the sensitivity is decreased, so that basically it seals off the tubules. And it sets by the physical reaction, means drying. Suspension liner. Suspension liner are water soluble, used to line only the dentine. They also set by the physical reaction, which is drying, and example is the calcium hydroxide. Now, let's talk a little bit about bases. So bases basically are they are applied in a more thicker quantity. So it replaces the bulk of the dentine. Placed on dentine close to the pulp, provide protection from toxic and the thermal irritants. So very deep cavities with an area very close to pulp. So whenever you are drilling down and you are very close to the pulp and you have removed a lot of tooth structure, you can place a base. Resin modified glass ionomer cement or zinc phosphate cement base over a calcium hydroxide are the preferred ones. Now, what are the different kind of the materials that are used as bases? The number one is the zinc phosphate cement, and it is very commonly used in the dental clinics. And whenever you apply zinc phosphate cement, it is a must to use the varnish prior to placing the zinc phosphate cement, because it can irritate the pulp. The second one is the zinc polycarboxylate, third one is the GIC, and the fourth one is the ZOE. And ZOE is not used with the composite because it inhibits polymerization. So this is a very important point. Please pay attention over this one. So it is not hard setting, it is hard setting. Calcium hydroxide can also be used as base, thicker than when used as a liner. I already told you the difference between a liner and a base is that liner is used in a very small quantity and bases are in a thicker quantity. Now, moving ahead, let's talk one by one of all these cements: zinc phosphate, zinc polycarboxylate, GIC, and ZOE. Now, the number one the cement that we will be discussing is the zinc phosphate. Composition: so the powder is zinc oxide and the magnesium oxide. Liquid is phosphoric acid and the water. It is the oldest and the most widely used cement. Retention is by mechanical interlocking. It doesn't have a chemical addition, so it is mechanical interlocking. It has a superior strength compared to other elements, means when it is compared to zinc polycarboxylate or GIC and all that stuff. It is applied in a relatively low film thickness. It has a relatively low solubility in water. Primary use is as a luting agent. Now, what are the advantages and disadvantages of zinc phosphate cement? Advantages: it has a long record of clinical acceptability. It has a high compressive strength, acceptable thin film thickness. Disadvantages: as I already told you, we have to apply a varnish prior to placing the zinc phosphate because it has a low initial pH. Post cementation sensitivity, no chemical bond because it binds mechanically, so no chemical bond to the tooth, so and it doesn't have no anti-carcinogenic effect unlike GIC. So frozen slab technique: whenever we have to mix zinc phosphate, we use the frozen slab technique. So we have a slab that is actually cold. So cool slab for mixing is the best way to extend the working time. So if you have to extend the working time for zinc phosphate cement, so you mix it on a frozen slab. Add a small amount of powder to the liquid. So what are the advantages? It increases the working time using this frozen slab technique. There will be short setting time and high powder liquid ratio, lower viscosity of the mix, and stronger final set. Viscosity means how watery or how thick it is. Moving ahead, let's talk a little bit about zinc polycarboxylate. Again, the composition: powder is zinc oxide and magnesium oxide. Here liquid is polyacrylic acid and water. The bonding is chemical addition, whereas with zinc phosphate it was mechanical. Advantages: it is kind to pulp unlike zinc phosphate. Chemically bond to the tooth structure. Disadvantages: it has a short working time. It is highly viscous. Requires separate tooth conditioning step prior to cementation like etching. Now, the liquid should be dispensed just before use because the water in the liquid evaporates quickly, so it has the increased viscosity. Powder should be rapidly incorporated into the liquid. Rapid spatulation and fast setting will lower the viscosity. So the more rapidly you are going to mix, the faster it is going to set, and there will be less viscosity. Long mixing time will increase the viscosity. So the more slowly you are doing it, the more viscous it will be. Working time is much shorter than zinc phosphate cement. So you have very less time to work on mixing the cement. Moving ahead, let's talk about GIC. Composition. The powder is fluoroaluminosilicate glass, liquid is polyacrylic and water. So it also binds chemically to the tooth and certain metals, and it has a micromechanical bond to the composite resins. That's why we know about the sandwich technique that is used in class 5 restorations, because it has a good micromechanical bond with the composite. It has a high biocompatibility, and no lining is required if there is more than 0.5 millimeter of dentine remains. Ideal material for root surface caries, which is class 5. Only glass ionomer cement is used as a permanent restorative material in class 5 restorations. So the GIC surface must be protected to prevent dehydration or premature exposure to the saliva. So whenever you are putting the GIC, so you have to protect it, so that it does not get exposed to the saliva. Advantages, as we have already mentioned, it chemically bond to the enamel and the dentine, and it has an anti-carcinogenic effect because it releases fluoride. Coefficient of thermal expansion is similar to that of the tooth, is an important point. Sometimes they love to talk about out of all the options, which one has a coefficient of thermal expansion similar to that of the tooth. It has a high compressive strength, low solubility after initial set. Disadvantages are low initial pH, post cementation sensitivity. Sensitivity to both moisture contamination and desiccation. Desiccation means dryness, and it has got poor aesthetics as compared to composites. So a freshly prepared GIC mixture is hygroscopic, which means that it absorbs water from the surrounding environment. That's why we need to protect it and the exposure to the saliva. After placement, the GIC surface should be covered with the plastic matrix for about 5 minutes to protect the material from gaining or losing water during the initial set. When the matrix is removed, the surface must immediately be protected with the varnish supplied with the GIC. Now, the last one we're going to talk about in detail is the ZOE, or zinc oxide eugenol. The composition is again powder is zinc oxide, liquid is eugenol. So we know that eugenol has a palliative effect on dentine, and it relieves the pain, and it has a neutral pH. But if you apply, you cannot apply directly on the pulp because it can cause pulp necrosis and should not be used direct. So it should not be used directly on the pulp. It's used as a sedative or a temporary filling material, also as an insulative base and in interim caries treatment. So it can be used as a temporary restorative material. So ZOE is soluble in oral fluids, and it is difficult to remove from cavity preparations. Should never be used for temporary cementation of final fixed prosthesis. So you can only be used, ZOE can only be used as a temporary cementation material only for the temporary crowns, not for the permanent ones. Since the cement can be difficult to remove, and removal can risk the integrity of the prepared teeth. Contraindication as a base or liner for composite resin. We already talked about it. Why? Because it inhibits polymerization. In case the patient has allergy to eugenol, lots of people do have the allergy to eugenol, and even during direct pulp capping, it is contraindicated. So these are few contraindications of ZOE. So this was all for today in the restorative materials. I hope my lecture did help you guys out. If you have any questions, please feel free to ask, and you guys can even follow me on Instagram under the same name, INBD Tutor. I will be coming back with some more videos. I hope they will be helpful to you guys.